examining strategies to cope with survivor's guilt following traumatic life events. This research is conducted by Aksa Chaudhry, Kelsey Hilsenbeck, Julia Romanello, and Justin Tyndall. Survivor's guilt is a phenomenon that individuals who undergo traumatic life events can experience. This can be expressed in multiple different ways, and there is seen to be a strong link between survivor's guilt and PTSD. The purpose of this study is to research the link between coping mechanisms and the development of survivor's guilt. Our focused areas consist of critical care nurses, COVID-19, treatment implications, and cancer patients. The reviewed literature related to cancer survivors reveals that common coping mechanisms were used, as well as different coping mechanisms that were not so common. The studies by Bash et al. And Samariva et al. Explain coping strategies used by cancer survivors, acknowledging positive thinking, social support, and religion as the major coping strategies used by the participants. Perloff et al. Explains that through social support groups, these patients also benefited. Although similarities are present, the literature has differences as well. Samariva et al. Addresses home remedies and lifestyle changes being important coping mechanisms in the Hispanic culture. Due to cultural differences, this was not touched upon in studies by Bash et al., Perloff et al., or Han et al. Han et al. States that cancer survivors with lower income have higher rates of PTSD, although the topic of money had only been addressed in one other study as a major contributing factor to the individual's guilt. Studying survivor's guilt is significant to nursing research and nursing practice. Through personal research, there is seen to be a large gap in the research concerning survivor's guilt and individuals who experience this following traumatic life events. The studies utilized in this literature review explain that survivor's guilt is a phenomenon commonly experienced by cancer survivors, and the prevalence of this guilt does not match the amount of the research done to benefit this population. Therefore, this is significant because it addresses the gap in the research and can further future research for these people. This research is also important to nursing practice because by creating more research around this subject, it allows practicing nurses to better understand to give care to the individuals experiencing survivor's guilt post-traumatic life events.
The literature review presented undoubtedly indicates nurses in the critical care setting experience compassion fatigue, survivor's guilt, and post-traumatic stress disorder. This literature review is useful for nursing practice, education, teach, and policy. Motaghi and Duarte and Pinto Gruveria discuss the ability of managers and directors to learn from research studies and implement changes in policy, interventions, and training programs to support bedside nurses in reducing burnout and compassion fatigue. Buchanan and Walsh conducted interviews with nurses and allowed them to provide feedback and future recommendations for change they would like to see implemented. The recommendations for change address the need for on-shift counseling and debriefing with professional counselors and the need for safe working environments allowing nurses to voice their feelings of detachment and guilt. Additionally, the nurses discussed high patient workloads and their contribution to stress, burnout, and compassion fatigue in the workplace. Cohen-Katz discusses that mindfulness-based stress reduction, MBSR, was hypothesized to decrease the effects of burnout in nurses, and a program was conducted in the Lehigh Valley Hospital Health Network here in Pennsylvania. The hypothesis was supported and concluded that MBSR, mindfulness-based stress reduction, is an effective strategy for reducing burnout, and this program could be helpful if implemented in organizations. The literature review supports the idea that organization leaders and managers can reduce the burden in critical care nurses by implementing stress-reducing programs to combat compassion fatigue, survivor's guilt, and post-traumatic stress disorder.
My area specifically focused on COVID-19 with relations to survivor guilt/PTSD, not only nurses but citizens as well. After looking through a multitude of articles, the relationship between the pandemic and PTSD symptomology is strong. This is highly relevant because the pandemic is still ongoing and nurses need to know how to combat this feeling of stress. There could be a new wave of research due to this being a newly formed event compared to other subjects being researched right now. It is a fascinating concept that stress can form things like pre-traumatic stress, where one is worried about future events. So somebody in the pandemic right now might be worried about a post-pandemic world. How will the pandemic affect that world? That is somebody worrying about a future event instead of worrying about the past or current events. So this would be an example of pre-traumatic stress. Another intriguing concept is post-traumatic growth and how traumatic events can cause people to evolve into becoming better beings and better people in general. Research in post-traumatic growth could be implemented in hospitals, potentially during employee mistakes. So if an employee makes a mistake, instead of belittling that person, making them regress and making them be fearful of making that mistake again, it will help them grow from that mistake. This is what hospitals want employees to do. So with the right amount of research going to the subject area, hospitals and clinics can enable protocols to ensure that people who have PTSD become better for it and not disabled by it. In terms of nursing practice, part of holistic care is understanding the pandemic's effects on patients and healthcare workers alike. Mental health is an essential and it is beneficial for healthcare workers to take care of themselves, most importantly first, so that they may help others. Health policy can be affected as well. Hospitals that gave their workers more support saw their employees less affected by the stresses of COVID-19. This could affect hospital policy into becoming more attentive than before to their employees' stress levels during the pandemic. The possibilities of this research are endless, and as soon as one question is answered, multiple other possibilities and questions will arise.
Peters et al. Found trauma-focused cognitive behavioral therapy to be an effective intervention for reducing symptoms of post-traumatic stress disorder. Implementation of cognitive behavioral therapy and mindfulness-based stress reduction programs can be helpful in stress reduction and reducing symptoms of PTSD. Interventions which were reviewed include trauma-focused cognitive behavioral therapy, mindfulness-based stress reduction, cognitive processing therapy, and training for stressful situations. The commonality between these interventions is that they are psychotherapeutic in nature. Although each intervention is slightly different, they all have similar roots and aim to change one's response to memories, thoughts, or reminders of traumatic experiences. The common goal of the intervention studied was to decrease or reduce symptoms related to PTSD. Each study found their intervention to be effective at reducing or improving symptoms of PTSD. Some studies also noted in their findings that the intervention used was determined to be safe and acceptable treatment for PTSD. The review of this literature has led to significant support of our PICO question. Evidence was found to support the successive interventions in treatment of PTSD and related disorders. It can be said that the use of interventions certainly aids in the reduction of PTSD and can also be applied to survivor's guilt, as represented in some of the literature reviewed. There is still a significant gap in the literature in regard to survivor's guilt. However, the large collection of research on PTSD and interventions to reduce symptoms can be applied to cases of survivor's guilt. Cognitive behavioral therapies are well studied, but further nursing research would be beneficial to identify ways it can be used in acute care settings and similar institutions.